YouTube channel Network Education. I am going to upload some mock question paper 2025. So get ready to challenge yourself with these mock questions. Let's start our video. First of all, anatomy and terminology session. First question. Phalanx is a dash. Here are the options. Option A, tissue. Option B, ligament. Option C, cartilage. And option D, bone. Second question. Removal of ovaries called option A, ovarectomy. Option B, hysterectomy. Option C, oophorectomy. And option D, salpinectomy. Third question. Which pancreatic cells secreting insulin and glucagon? Option A, insulinate process. Option B, acina. Option C, pancreatic duct. And option D, islets of liquids. Fourth question. Bone-to-bone connection is called option A, ligament. Option B, cartilage. Option C, tendon. And option D, bone. Fifth one. What is called inflammation of wall of vein with thrombosis? Option A, sinusitis. Option B, phlebitis. Option C, pharyngitis. And option D, thrombophlebitis. Sixth one. What do you mean by Warthin's tumor? Option A, benign tumor on uvula. Option B, lesion of salivary glands. Option C, benign neoplasm on the salivary glands. And option D, tumor in uvula. Seventh one. Which term means the Seventh question. Which term means the tissue depth of an artery or arteries? Option A, atherosclerosis. Option B, atherosclerosis. Option C, atherosclerosis. Option D, arterioloclerosis. Eighth question. Which term describes a surgical puncture of the eardrum? Option A, thoracentesis. Option B, arthrosynthesis. Option C, tympanosynthesis. Option D, pleurosis. Please do the answers in the comment box. Okay, try to answer all these questions. Next is ICD session, ICD 10C. Here 5 questions are there. Ninth one. While at church, Fred was standing on a chair when he fell. He suffered a closed Cole's fracture and contusion to his right cheek, right elbow, right hand and left leg. What code did you report for this injury? So here are the options. We'll check it on the options and try to answer the right option. Here is the 10th question. Dr. Lloyd Bill's family physician performed a physical on a Bill in December. Dr. Lloyd noted Bill had a swollen glands, changes in blood test, and on chest X-ray, as well as the patient's report of general fatigue and weight loss. Bill was scheduled to see a specialist. The following week, Dr. Scapiro, the specialist, examined Bill, performed tests, and told him he had metastatic malignant melanoma from the left lateral chest, wall to the cervical lymph nodes. Today, Bill started treatment with Dr. Scapiro, directed to his lymph nodes. What are the correct diagnosis code for Dr. Scapiro's treatment? Here are the options. Okay, we check all the options. 11th. Robin, a firefighter, was burned while fighting a forest fire. He is being treated in a burn unit with burns to 30% of his total body surface area. The burns are reported as third degree to 25% of his body. The remaining 5% are first and second degree burns of the upper lip. How should you report the diagnosis codes? 12th one. Rosemary, a 42-year-old female, returned to her physician for treatment of glaucoma and problems with peripheral angiopathy of her feet due to diabetes. She has had problem controlling her diabetes and is insulin dependent. This diagnosis code best describes his patient's condition. You have to pose your meeting, try to answer all these questions. Okay. 13th one. Carrie, a 26-year-old healthy female, suffered a cardiac arrest with administration of anesthetic during delivery. What are the correct diagnosis codes? Next is in tickets, HCPCS session. 14th question. Army receives a new prosthetic wrist disarticulation molded socket with expandable interface, flexible elbow hinges, triggered span with an upper extremity addition, disconnected locking wrist unit. How will the facility reported the HCPCS level 2 codes? Fifteenth question. Bryce was burnt on his left upper arm and requires a graft of 9 square centimeter of tissue. He is being treated with a dermal and epidermal tissue substance of human origin, appligraft. What HCPCS level 2 code should be? 16th one. A 75-year-old patient with a history of malignant neoplasm of the lower gastrointestinal trace presents for his followed colorectal cancer screening. Today he has a colonoscopy. What HCPCS level 2 code describes this procedure? Next is the coding guidelines. 71. Standalone CPT codes have a full description. So here are the description. Internet codes are listed under related standalone codes, and internet code include the portion of standalone codes description which proceed the semicolon. The semicolon is used in CPT textbook. Is for word process. So this is the question. 18th one. Physical status modifiers are appended to codes listed in which major section of the CPT book: evaluation and management, anesthesia, surgery, and medicine. 19th one. What are the two sections down report in addition to the nation excision? Local anesthesia and single closure, local anesthesia and intermediate repair, local anesthesia, single closure, intermediate repair, local anesthesia. 20th one. True or false question. The following is an example of a correct code combination. The placement of a nastrogastric tube is reported with evaluation and management critical care code. It's true or false. Okay guys, this is enough for today. I will upload the next part in the next video. So stay tuned and bye bye.